Are you trying to figure out which is the best Medicare supplement policy? Now, before I answer that question, let me remind you the role of a Medicare supplement policy, also known as a Medigap plan. It is not your primary insurer. Your supplement is secondary to Medicare. So that means that by the time a claim gets to the Medicare supplement company, it's already been approved by Medicare, and the only question remaining is how much do they have to pay, and they have no discretion. They must pay whatever is defined by the plan you choose. So I'm sure you've seen this chart behind me. I made it a little smaller. I cut out some of the plans. There's actually 10 plans available, but we're going to look at 3 of them, F, G, and N. And if you look to the left, that column are the 9 different benefits that a Medicare supplement policy could cover. Now, I included F here, even though we know that F is no longer offered to new beneficiaries, new Medicare beneficiaries. But what you can see here is F covers every possible dollar gap, which typically then follows that F is going to be the most expensive. It's not covering more claims than G or N, but it is going to be more comprehensive. So when you look at G, which is next to F, it's identical except for one benefit, and that is going to be the Part B deductible. So under Plan G, and actually also under Plan N, the first $240 of Part B bills are going to be paid by you, not by your supplement. Whereas with F, they cover the $240. But so what happens is that it would make sense then when you look at this chart that since F covers the most, it's going to be the most expensive, and then G, which is very similar to F, but minus one benefit, is going to be a little less expensive than F. But so now where do I usually talk to, where does my discussion usually go with most people? It's going to be G versus N. So in looking at G versus N, G is going to be more comprehensive than N, which means G is going to be a more expensive premium than N. So how do they differ? Well, as I mentioned, with both plans, you are responsible for the Part B deductible, but here's where the major difference is. Once the deductible is met, Medicare is responsible for 80% of your bill, and then there's 20% remaining. Under G, they're going to pay 100% of the 20%. Under N, they're going to pay the 20% minus a copay that you could owe, either $20 for a doctor visit or up to $50 for an emergency room visit. One other difference between G and N is this Part B excess charge. Most doctors sign on the line with Medicare and they accept assignment. So what that means is that they accept whatever Medicare pays. There's a small group of doctors out there that are contracted with Medicare, but they don't accept assignment. They can then charge 15% over the Medicare approved amount. Under Plan G, that 15% is covered. Under N, it is not. Now, from a statistical standpoint, they say maybe 2% of the doctors don't accept assignment, and that a lot of them are psychiatrists, but we don't have exact lists. But so that's another factor that you think about when you're looking at G versus N. But N is a very good option for people that want to stay in original Medicare, but they are thinking about their pocketbook a little bit more. Maybe they want to save on premium. So here you're going to pay a little bit more premium up front, but you know exactly your cost. Here you're going to pay a little bit less premium, but you are going to contribute with those copays that I mentioned. So which is better? Well, clearly, if you're not thinking about your wallet, G is an easy way to go. Once you've paid your $240, you're not contributing outside of your premium to the cost of care. But is N equally good? Because it's going to cover the same claims as I mentioned. Medicare's already approved it. It's just you may have to contribute a little bit towards the claim, but you're paying a lower monthly premium. So you tell me which is better for you. Which system, which plan works better?